our favorite art therapy dynamic duo, Dr. Chris Strang and Dr. Patricia Isis. I will say before I turn it over to them, just to remember we are recording. So if you don't want to be visible, then please feel free to turn off your camera. But we'd love to see you. And I'm just so happy that we've got our two wonderful art therapists with us again. I think, is this the fourth? Or this is the fourth time?
A fourth time.
Number 4. So I will, at this point, stop talking and turn it over to them. And again, thank you so much for being here.
Sharing my screen here. Hopefully everybody can see that. So welcome everyone. I'm Chris Strang. I'm an assistant professor in the behavioral neuroscience program at UAB's Department of Psychology. I'm a board certified art therapist and a certified eating disorder specialist. I have over 35 years of clinical experience. You can tell by the gray hair. I'm really excited to be invited back to do this presentation with my good friend, Dr. Patricia Isis. This is always such a great experience for us, and I hope you'll have as positive an experience and enjoy it as much as we will.
Yes, and it's a pleasure to be back working with Chris and this wonderful team over at UAB. And I'm having a love affair with art therapy after 43 years. Every year it gets better and better. We all should have relationships like this. You can see I have a lot of alphabet soup after my name. I'm a PhD in the expressive therapies with an emphasis on art therapy, and a licensed mental health counselor in Florida, also a qualified supervisor, and also a certified art therapy supervisor and registered art therapist. However, I've also been teaching and practicing mindful self-compassion for many years, and hope to share some resources with you here that you can take with you easily and integrate them into your life. That's the hope.
So I just wanted to give you, we want to give you kind of an outline. We're going to start with setting an intention, and then we'll talk about mindful self-compassion and what it is and why it's important. And then the whole point of this presentation and this time together, we'll talk about miracle and joy spotting and what is it and why it's important. Then we'll do a little bit of a warm-up, and then you'll have the opportunity to make some art. We'll reflect upon it and kind of bring everybody together in closure. And we have some resources we'd like to share with you. So we'll start with intention setting.
Yes, and so this is not a high effort. In fact, it's a very light effort. This is a practice of checking in, pausing for a moment, and asking your heart, hey, heart, why are we here? We could be doing so many other things right now. What's in it for us? What matters the most to you right now in terms of spotting miracles, spotting joy, in terms of that impact on your life? If something emerges in your awareness, may I begin to understand the way I am, or anything in terms of one word. It could even be a little doodle if you like. But the idea is that it anchors us. It gives us a place to land so that we make this matter, because it is a very profound, meaningful opportunity for you. And in general, if you'd like to start setting intentions, maybe you do it already. It's a lovely ritual. It's called a living vow. And it helps, again, set us straight in terms of what our direction is. Not so much on a goal, but more a direction, a tone. So we are not giving you a whole bunch of time to do this. If you're not coming up with anything, and if at any time, anything Chris and I invite you to do seems to feel uncomfortable, please back off and just watch. Take care of yourself. I can't hear you, Chris. You're
Sorry. Yeah, if you'd like to add your intention to the chat, you can. You're not required to, and it may just be an intention of being in the moment or taking a breath. It's just about being here and now.
There is no wrong answer.
Gratitude, presence, Intentions can be simple in one word.
It might be something you say often.
Self-knowledge, open and self-kindness, connection, clarity and understanding. These are beautiful.
Yeah.
Softness.
Notice how your body feels when you say it to yourself. It can be a mantra for you all through the day, all through the night.
Okay. Open to positive possibilities, reframing, sometimes just making it through to the end. Okay. Quietness, envisioning. Right. We're going to go ahead on to the next slide. If you still want to add intentions to the chat, you may.
So just to give you a quick crash course in self-compassion, Kristin Neff, who's a researcher at the University of Texas at Austin, in collaboration with Dr. Christopher Germer, who's a psychotherapist and teaches at Harvard Medical School and also the editor of many books on mindfulness and psychotherapy, together they came up with a curriculum for helping the average person cultivate self-compassion, or the ability to treat yourself the way you treat others that you love when you're struggling, the same way you treat them when they're struggling. So she came up with 3 components initially for part of it. It's called the yin of mindful self-compassion. And so I recommend that you may participate with the hand gestures here, because then you can feel it. Because when we're talking about mindfulness, we're talking about a felt experience. It's pre-verbal, pre-conceptual. So if you're comfortable making a fist, I invite you to do that and just notice how that feels. Many people, if you want to put in the chat room what you notice or call it out, that's okay too. When you have your hand like this, what does it feel like? What do you notice? Strength. Jaw tightening, tension, exactly, power. This represents resistance. This is what we do naturally when we're dealing with adversity. We resist because we don't like it, we don't want it, and it just came. So we push against it. But what we resist persists. Although it's normal, every human does this. Yes, heaviness, very common. So if you just open your hand so it's flat, notice that experience. That is mindfulness. That's the practice of opening and allowing everything inside and outside our bodies that we are paying attention to with kind, curious awareness. It's the truth of the present moment. So you can see how when we recognize what's my experience right now in my body, in my life, then we can decide how we want to relate to it once we pause and check in. Self-kindness, if you place your hand on your heart, 1 or 2 hands, if you don't mind, if that feels right, is the practice of supporting ourselves, offering ourselves loving kindness and tenderness. It could be in any form. It could be in the form of an image, a word, a texture, a taste on your tongue, a sound. Everybody has their own way, because when we're struggling, we tend to beat ourselves up. This is the practice of saying, oh, yeah, this is hard. This is really hard for me, because I know, and the third component is about connectedness, because I know I'm not alone ever in my suffering. Whatever I'm going through in this moment, at least 1 billion other people are going through it. So we are not ever alone. So these 3 components equal loving, which is the mindfulness, connected, which is the connectedness. Loving is the self-kindness, loving, connected presence. That cultivation of presence, of really being here for ourselves first, then everyone else. But it does take practice. And so the yang of mindful self-compassion is fierce compassion. That's acting in the world. And those 3 components, as you can see, are protection, boundaries that are healthy, when we're feeling like, ooh, this isn't good for me, I need to set a boundary and maintain it to provide for myself, for my wellness, for my balance, and to motivate myself to maintain that boundary while I'm cultivating loving, connected presence. So the two together create a magnificent bouquet of choice of different resources according to what resonates most with your heart.
So
go ahead.
No, go ahead.
No, you start.
Okay. Well, so the idea is, so with this compassion, the connectedness, what the thing we fall into initially is that resistance, right? We have what we'll talk about as a negativity bias. And the idea is that focusing on the bad, the scary, the anger, the loss, this is often a survival trait, right? Evolutionarily, we want to make sure we catch everything, all the stuff that are threats. Our evolutionarily, our bodies, our minds would rather have 1,000 false alarms than miss one true threat. So we are kind of biased towards anxiety, biased towards the negative, biased because we want to avoid the things that have the potential to cause harm, whether it's physical harm or emotional harm. So that's kind of where we start most of the time. But we can do so much better than that. We can do more because life is about more than survival and avoiding unpleasantness. So the idea is life is about living. And so this practice is about finding those things that bring us joy and moving towards them and holding them in our hearts. So for me, that's what miracle spotting is about, is learning how to spot little tiny joys, little tiny sparks, little tiny things that give me more than the negativity. It gives me more than just avoiding unpleasantness, but allows me to move my heart towards joy.
That's so well put, Dr. Strang. And really, this is another form of a gratitude practice, which is a wisdom practice. There's an old saying, the only thing better than getting what you want is wanting what you have. And when we're practicing miracle or joy spotting, we're really practicing a very tender, curious attention to what is happening that is working for us, that is going well for us. We're acknowledging the small and large factors that contribute to the fullness of our aliveness. And we can do this in any way we choose. Generally, there is one sense that is easily accessible over other senses for most people. So if you're a visual learner, maybe it's easier for you to look for the littlest thing in your setting, or notice in your mind's eye what comes up that you can really appreciate. The fact that I'm looking at this screen right now and offering this work to you all is a miracle, that we could all be sitting here right now. It's so small and subtle, and yet it inspires great freedom for us, because typically we have that illusion of separateness in our suffering. And when we realize the beauty of our aliveness, the richness, even and especially when we're struggling, that's an amazing practice of self-compassion and radical self-awareness and self-acceptance. And there's ample research that demonstrates that gratitude or joy miracle spotting not only enhances well-being, but reduces stress, depression, and in turn, as you can imagine, if you're already practicing, you feel more optimistic. Like we were saying, it's the antidote to the negativity bias.
Yeah.
And this also can lead to more self-care practices, better eating, more resting, improved sleep, and enhanced health overall.
Yeah. And it's not the whole you should be grateful type of thing. It's not the guilt-inducing gratitude. It's the gratitude of finding this moment of, I'm grateful. I have a breath. I got out of bed this morning. Some days are you just, it's the very, very tiny, subtle things. It's not a comparison. It's not about guilt. It's just about, in this moment, I'm grateful for the fact that I have electricity, that I can be here with you all, that I'm breathing. There are all sorts of different ways of doing it. So these miracles are just the very small, subtle, simple things, and they build.
And we tend to look outside for them. And I just want to extend an invitation, if you feel comfortable doing so, noticing inside qualities that you have that you've been able to rely on to get you through hard times. Perhaps the fact that your heart's beating, your lungs are filling, the tiniest thing that we can move, we can talk and we can move. It's quiet. It's not ecstatic. It's subtle and yet extremely hopeful and satisfying.
And with that in mind, we're going to move into kind of a warm-up about how to take care of ourselves.
Yeah, and this is called a safety mandala, as you can tell. And it's a great graphic to introduce to us how we are emotionally from moment to moment when we're in safety, and consider how you know when you're feeling safe. What are the things that inspire safety for you? Because when we're feeling safe, we're not going to grow, we're not going to move. However, we need safety as a grounding place for ourselves to know that it's there for us when we need it. Because when we move into challenging, like we've been forced to do with the pandemic and the litany of other challenges that come into our lives for a myriad of reasons, that's when we grow. That's when we know our strength, our ability for resilience and thriving. However, it easily can happen, and it does, that we drop from challenging, slipping into overwhelming, and we feel it in our body. That's when anxiety turns to panic and grief can turn to depression. And we know there's been an extremely high number of panic in the world right now. So what we're introducing here is your ability to be aware of your place right now in your body and in your life. And so when you feel challenged, noticing what that feels like in your body. Where are you starting from now? If you're overwhelmed, we need to, when we feel that way, we check in, we're saturated, we move back to safety intentionally. This is all done with intention. The reason we move from often anxiety to panic is because we're resisting. We're pushing against it. Oh no, it's coming, it's coming. Oh no. And it gets bigger. This is a practice of, I feel it. Okay, now I know what I need. I need to go outside. I need to take a breath. I need to, whatever it is that you need for safety. So we wanted to make sure you knew this with miracle spotting, because things can trigger us when we least expect it.
Sometimes we're looking for positive triggers. That's where the small miracles come in too. We're used to looking for negative triggers, but sometimes we can have a small positive trigger as well. So again, it's about being aware and being in the moment. So notice where you are right now, where you're starting from. And no judgment, it's just where are you right now, and notice. And we'll move from there into the idea of using artwork to help hold on to, because where the art comes in is, how do we hold on to, how do we make a record of, how do we validate and make it real, so it can be effortless, but we want you to be able to hold this moment too. And that's where the art is a beautiful record of things, even if you're judgmental about your art. It's a place to start.
Exactly. Art contains our experience for us. And I think one of the most difficult pieces of this practice is remembering. We forget, because this is not a habit. Because of the negativity bias, our habit is to look at what's wrong. This is how we're wired. What we could have done better, how we messed up, and that's about survival. So we're inviting you with light effort to drop into your body and posture yourself in a way that allows you to feel relaxed yet alert. And notice as you pause what you sense, what you see, what you hear, feel, taste, smell. What do you notice when you dip into that part of your awareness?
So, as you notice, we invite you to create that experience, just to create a representation of that experience in lines, shapes, colors, words. You might be interested in movement rather than drawing or writing. What we want you to notice is um, what you appreciate and how you're dipping into that place of gratitude, but mostly you're just using lines, shapes, colors, words, movement, poetry to make a record of where you are here and now.
And there's no wrong answer. It's what you know you need. It's from your heart. This is heartfulness. You could even doodle. So we're inviting you to not be attached to the outcome. If you can let go of any judgment about how it looks or how you want it to come out, but rather just going with whatever feels right. We're making the invisible visible. We're giving form to your experience of miracle and joy spotting. See what happens.
And if you need a little bit more direction than just lines, shapes, and colors, maybe notice your heartbeat, your lungs filling and emptying, the fact you can sit here with us and empower and expand your appreciation lens. Whether this is a time that's pleasant for you or unpleasant, because, granted, the holidays are often challenging. Or have mixed emotions. So wherever you are in the moment, see if you can notice subtle joy or small miracles. And then just however you choose, make a record. And we'll give you probably about 10 minutes to do art, and we'll kind of see where people are. If you wish to, I'm going to put once you get started, I'm going to put a link in the chat to a Padlet where if you wish to, you can photograph your work and add it to this Padlet. It's an online piece where you can share your artwork with others. And if you haven't gotten started already, go ahead and get started.
And notice your body as you're working. we have about a couple more minutes. Is that right? Yeah. So see if you can gauge yourself. Of course, we don't expect you to finish it necessarily. We wanted to give you a taste so that you could get a sense of what resonates most with your heart.
As you finish up, or at least find a stopping place for now, we'll move into reflection and give you a chance to kind of talk about and reflect on your experience. And also, please feel free to upload anything you're willing to share in the Padlet, and we'll be able to share that screen as well as people continue to upload images there.
Yeah, we're particularly curious about what you noticed as you were practicing joy or miracle spotting and giving it form in any way you wanted, writing about it or moving about it or drawing about it or doodling about it, whatever it is. Did you notice a shift in your body? Did anyone notice anything like that? Certainly put it in the chat room if you'd like. And we're again, that idea that we know it will connect with our heart when it's right for us, softness, gentleness. And notice which part was particularly resonant with your heart. That's where you want to go with this.
Noticing the tension that was leaving. That's one of the wonderful things about creating art is often the tension moves from our bodies onto the page.
And we're there for it.
Yes.
We're there for that shift because we're paying kind, curious, hospitable attention, because we're giving ourselves compassion for being human, that we're not perfect, that we make mistakes, that we fail. And yet we still can have agency over our attention and where we want to put it and how we want to utilize curiosity, creativity, and compassion. I see Holly's comment.
And Heather's. These are beautiful comments.
Yes.
So to me, the small miracle and the small joy that I'm experiencing is how this is resonating for people, and that to me still feels miraculous and wonderful as I see and get to experience people being able to participate. I think I can probably make the Padlet larger. Yes. Let's see.
I'm curious if anybody ran into some challenges with this also, because that's likely too. It's not that we're trying to make the adversity go away. Rather, we are shifting our attention to what is actually here for us in our bodies and in our lives, and then choosing how we want to relate to it from a joy lens, from a miracle lens, through that lens.
And as you're thinking about your experience, notice what somebody else has posted, whether it resonates for you. And because that lens, and that's the connection part. And then also start thinking about how you can integrate this into your own life with light effort. Right? How do you pull this in and keep these feelings, even if it was challenging? How do you keep this record and experience alive for yourself?
Yes, how can you leave this session and have a new resource that you didn't realize that would be useful to help you remember to practice? It could be as simple as putting your hand on your heart. It could be as simple as putting your artwork up in a prominent place so it reminds you.
Mm-hmm.
Or perhaps when your alarm goes off in the morning, you have to decide, oh, it's time to joy spot.
Yeah, I love the coming up. I love all the voices here, wanting to stay with soft colors to reflect your heart's desire, coming up with a ritual for healing, adding musical notation. There are all so many different ways that people can integrate and pull this together.
And you're right, Helene, this is a beautiful ritual that we can easily weave in without putting it on our to-do list, something that we easily somehow move toward with, like Dr. Strang said, with light effort, a light touch.
Mm-hmm. Gentleness with ourselves. Mm-hmm. That the statement, "I am here," is just such a powerful statement to me. And it's kind of the core of everything.
So true.
And the sense of surprise at what you find. All of these are small miracles.
Before I get out of bed and think, yes, very often the morning is a time that's most quiet in the world. Some people like to light candles for their ritual. Some people might doodle as part of the ritual. Only you know what you need to make this satisfying for you and easy and enjoyable.
So finally, we want you to think about, and this may be a place where you can ask questions in the chat or even ask to unmute. Think about, what can you take with you from tonight, from this experience? And what questions do you have for either Dr. Isis or I?
Yeah, what is it that you have now that you didn't have when you first joined us? Have you noticed anything that came up or something that you had forgotten about that came back to you, that your art maybe reminded you of?
Please feel free to speak or to unmute yourself and speak. I need to not always be in a hurry. Yes.
Yes, and we're all slow learners. When I was going through a health concern in 21, I made a spiral, a womb diagram with self-care ideas and self-talk in multiple concentric circles. Around the outside, I added handwritten names of strong, powerful women in my inner circle. Wonderful. Surrounded by powerful women. And there you are. You came back to that wonderful image. Thank you, Carrie.
I love these choices. Choose safety, not retreat. That there always is support. And then the idea, asking, I love this idea, Heather, asking yourself, what is the question, what is going on, and proceeding from where you started, or proceeding from where you are now.
And so what happens is now you have the experience. The experience no longer has you. You have agency. Letting flow. Thank you, Bella.
Yeah. I see these choices around structure. The idea of I might think I need structure, and sometimes I do, but then I can make choices to let that structure go and be surprised by what I find, or letting it flow. That we get letting go of outcomes, starting over. Um, ah, and then I couldn't upload my drawing, but drew a wilted flower. Thank you for trying, Victoria. Sometimes the tech is not the miraculous part. The idea that we can rest and not always have to be flourishing and beautiful. Sometimes we need to become closer to the earth. I love that.
Oh, yes. And sometimes we need a rest because we're wilting. We need to rest and
Yes.
renew ourselves.
I love that people are feeling connection. Thank you, Kimberly.
Yeah, we're social animals and we all long for that. And everybody here matters. Everybody belongs. Everybody has a contribution to make that's valuable. And that's another thing about this practice of miracle spotting, is that it reminds us of our value as humans in the world, that we can bring this to ourselves and in turn bring it to others that we encounter. So it's really bigger than us, much bigger than us.
And we know we have the experience, and it resonates more sometimes when we realize we're with somebody and they're in a bad mood, and we start sharing that mood, and we can be with them there. But the other thing is that when we're finding the miracles and we're centered and grounded in ourselves, we also share that with others, and they resonate with our strength and connection and our centeredness. It doesn't always have to be happiness or positivity, though that can be part of it. But when we're centered, we help others become centered. When we're compassionate towards ourselves, others can learn by watching what that looks like, because we don't always see it.
Exactly. Because of mirror neurons. And others will mirror this attitude that we have of astonishment and appreciation. I love that Mary Oliver poem. It's 3 lines. Pay attention, be astonished, tell about it. And so I wonder if we could open up the gallery and see if we have a few minutes, if anybody wants to share their work or say anything to the community.
I think it looks like people might have had some trouble uploading, but please feel free to speak up, or to if you have any questions that you want a little bit more information, we have some resources on the next slide, but I want to make sure that everybody has a chance to share or talk if they wish.
Hi, this is Jerry, and I just wanted to say thank you for this. It's been a while since I've done something like this, and it's been very useful to kind of reconnect with that energy flow that keeps us, as you say, grounded and allows us to process things that could be challenging for us. So thank you very much.
Thank you.
Thank you.
I agree. This is Robin. I thank you also, and I don't have the most beautiful drawing in the world, but I am going to hang it up in reminder of what we did, and I'm going to try to start my mornings with a brief time like this, because I noticed such a vast difference in my body and my head. The way I had a horrible headache when I logged in, it's gone, so it's like it's a good form of release and a good way of centering, which I don't always take the time to do, and I need to do that. So this will be a good way that I enjoy very much. So I'm going to hang my drawing up to remind me to do it.
Nice.
That's love.
It's beautiful. And thank you for identifying hope, Mark. That's important too.
Definitely. Does anyone want to share their art with everybody else? Or their whatever? Does anybody feel like I'm already enough? Yes, you
Yes.
are.
Mhm. Right. Yeah. I saw it briefly, Heather.
It's just I don't have my camera with me to take a picture to upload it to
Yeah.
my.
Well, and actually, that's a really good point because I'm going to leave the Padlet open for a while. So if you guys, it's hard to get everything together in such a short period of time, but I'm going to leave it open for about a week or so, or longer if I forget. But we'll leave that open. So if it's something that you want to add your picture to later, you're welcome to, or if you want to go back and check on it, it'll be available so we can keep this connection and keep the miracles, the record of joy, available for a little while.
I just have one comment, and this is not to be. I don't want to be Debbie Downer or anything. And it's not that. It's just that I'm centered right now and regulated right now because I did some things today to get myself to that place. Yesterday I was not, and I was being triggered, and I was dysregulated for a number of things. And when I'm in that, the resistance is very strong, and the self-compassion is almost not available to me. It's very hard to bring up self-compassion when I'm already in an unsafe, where my brain feels I'm unsafe. So I practice all sorts of different lovely, beautiful things when I can get there.
Yeah, that's such a human experience, and this is why it's all practice. You may notice either sometimes it's easier to get re-regulated, easier to get, and you said almost unavailable, and that gives me that, that connection. And yeah, there are times where we're not connected to it. There are times we struggle, and there are times we're triggered, and this is when it's most important to try, or maybe not try, but to give yourself notice where you are in the moment. But yeah.
May I ask a
Oh,
question? Oh, sorry, never mind.
yeah.
Well, the question was, as we practice, and I know about pathways and developing new pathways, my only question is, do I have to heal what the resistance, do I have?
Healing is a process. There's the practice is part that helps healing, right? You don't have to it's not a linear thing, right? It's not you have to do this and then this and then this in that order. No, and I'm sure Patricia can add to this, because what you're asking is important for so many people. There's not the set of stages that you have to go through. You're going to take a step forward, a step back. Think of it as a dance or a movement, and sometimes you're wilting and needing to be closer to the ground, right? You are where you are who you are, and the process is to love yourself and find that compassion in no matter what space you're in at the moment. And sometimes it's compassion, it's like, oh my gosh, I couldn't find it then, but when I look back, that's what I felt then, and compassion for yourself in the past.
And so, Heather, the fact that you could notice that you were dysregulated yesterday, and notice that's the practice that you're struggling. And so the mindful self-compassion question is, what do I need right now? What do I need? And today you gave it to yourself. And it's not to take the difficulty away. It's to soften and shift the relationship so that we have it. When you feel it, you can heal it. When you name it, you can tame it. And yes, it's not instant relief at all. However, it is a new relationship of tenderness and kindness and authenticity that we easily give to anyone we love who's struggling. So I really, like Chris said, I really appreciate that you brought that up, because so many people, I'm sure, can benefit from hearing about that. You're not alone.
Mm-hmm.
I can see that,
Yeah.
that we're out of time,
Yeah.
practically.
Yeah. And there's some beautiful comments in the chat, that sometimes drawing and processing was fulfilling. Sometimes it's easier to do one thing or another, and the idea that we might need to be in a place of safety to do the processing is really great. We are just about out of time, and I want to share some resources. We'll put those in the chat. Compassion to everyone, and you're very welcome, Deb. We'll put these resources in the chat. And Patricia, I think you should take just a second or two to talk about some of the pieces you have available.
Yes, if anybody's interested in pursuing a mindful self-compassion practice, I wanted to offer you a few resources here. The top one, the Center for Mindful Self-Compassion Circle of Public Practice. This is the sign up. It's available daily, once in the morning and once in the evening. And if you're interested, it's free. It's 45 minutes. I typically lead on Tuesdays, although not tomorrow, but you can see on the sign up what teacher is there. And it's a whole together opportunity of like-minded practitioners. The next resource is a New Year's retreat that I'm going to be facilitating 1 hour along with Kristen Neff, who's the co-founder of Mindful Self-Compassion. That's free. It's 2 days on December 29th and 30th. There's 6 different teachers in that. And then I'm teaching a short course of Mindful Self-Compassion on Zoom, January 22nd to March 4th. If you're interested, there's a link. I don't know if that's an active link, but it's through Mindful Kids Miami. I also put my email in the chat room if anybody wants more information about this. And the last one, the last reference there is my book, the Mindful Doodle book, 75 Creative Exercises to Help You Live in the Moment. So if any of those might be useful to you, it's available for $20 on Amazon or wherever books are sold.
Right. And finally, just want to acknowledge UAB and Institute for Arts and Medicine, again, for having us, the American Art Therapy Association, the Alabama Art Therapy Association, and the Florida Art Therapy Association. Thank you all so much. Enormous
gratitude. Thank you. Thank you, Kimberly, and everybody at the the UAB team, Lauren, everybody. I don't want to leave anyone out. You know who you are.
Yes, thank you both for joining us. It's always just a joy for me to get to be with you this time of year. And thanks everyone for joining us. And we'll be back on the second Monday in January, and we're actually gonna take a little look back. I see Helene Taylor right there. Helene in this group is one of our founding members of Arts and Medicine, and so next week next month we're starting to celebrate our 10th anniversary of Arts and Medicine, and we'll our virtual Mental Health Monday will be a little time of highlights. And so Helene, I'm hoping that you'll be on there as well. And but thank you everyone so much. Thank you, Dr. Isis and Dr. Strang. Just wonderful.
Thank you all.
Thank you. Happy holidays, everyone. Be safe, be well.